Hello, everyone. This is Dr. Jennifer Teal back with another presentation on ICD-10-PCS coding. This time, we will be discussing how to identify the correct root operation. Root operations are very important first step in building your ICD-10-PCS code. The root operation is reflected in the third character, and it actually describes the objective of the procedure. What is it that they are actually trying to accomplish? Each root operation has a precise definition that must be applied. And typically speaking, the root operation is going to be the main term that you use when utilizing the alphabetic index in your ICD-10-PCS code. Always a word of caution that the terminology used in the medical record documentation may not be the same terminology used in ICD-10-PCS. So as a coder, it is your job to translate the information in the health record into PCS terminology in order for you to build a complete and accurate code. Before we get into the purpose of the presentation, which is to identify root operations, I want to first go over some of the pertinent guidelines that are applicable. Now, there are more guidelines than what I am going to cover today, so make sure that you take the time to thoroughly review all of the guidelines. As a reminder, the guidelines are always listed in the front of your code book. So you should have a section that's titled the ICD-10-PCS Official Guidelines for Coding and Reporting. You can also find these guidelines online if you do a simple internet search, if you would like to have, say, a PDF version of the guidelines versus what is available in the front of your book. The first guideline I want to go over is one of the general guidelines, and the general guidelines apply to all sections. So guideline A11 states that many of the terms used to construct PCS codes are defined within the system. It is the coder's responsibility to determine what the documentation in the medical record equates to in the PCS definitions. The physician is not expected to use the terms used in PCS code descriptions, nor is the coder required to query the physician when the correlation between the documentation and defined PCS terms is clear. So that's what I just stated a moment ago, where whatever terminology is documented, you have to look at the context of it and determine how that equates to PCS terminology. So as a coder, you are going to be doing that translation. And the example given here in the guidelines is when the physician documents, quote, partial resection, then the coder can independently correlate partial resection to the root operation excision, because excision is removing a portion of a body part. So a partial resection would be removal of a portion. So the coder can make that translation without having to query the physician for clarification, because it is very clear what was done. Now, if it's not clear, by all means, you can query providers, but not simply because they are not using the same terminology that is used in ICD-10-PCS. The next guideline is guideline B31A. And this is an important one because what it's telling you is that every root operation has a definition assigned to it. The full definition of that root operation must be applied. So you can't select that root operation if the full definition does not apply to your scenario. So if something is different with your scenario, then that full definition doesn't apply, and you should not be using that root operation. As a reminder, when you're in the tables section of your ICD-10-PCS book, up at the top of the table, the first 3 characters are always listed out. And remember, the 3rd character is where you find the root operation. So when you're in the tables, the definition is always listed right there beside the root operation term. So that is a good way for you to double check and make sure that you have indeed selected the correct root operation. Review that definition and make sure that that full definition applies to the scenario that you are coding. The next guideline, B3-1B, states that components of a procedure specified in the root operation definition or explanation as integral to that root operation are not coded separately. So basically, it is an inherent part of that procedure, and you are not going to unbundle and code that out separately. So if components are part of that definition or explanation, you don't pull those out and code separately. Also, procedural steps that are necessary to reach the operative site and close the operative site, including anastomosis of a tubular body part, are also not coded separately. So these guidelines here are telling you when you don't code something separately, it is bundled within that particular root operation. You don't pull it out and code the components separately. So the next guideline we're going to go over is when you do actually code things separately. So this is the multiple procedure guideline. And this one is very important because a lot of times new coders are trying to figure out how many of the different pieces of the procedure are they actually supposed to code separately? When do they use multiple procedure codes versus a single procedure code? So these guidelines here in B3-2 cover the scenarios where you do indeed code multiple procedures. So B3.2, during the same operative episode, multiple procedures are coded if, and we have several A, B, C, and D. So the first one is if A, the same root operation is performed on different body parts as defined by the distinct value of the body part character. So when we say the distinct value, this is also an important concept when we're talking about body parts. If PCS gives it a distinct value in the tables, then those are considered distinct body parts or separate body parts. This also applies when we're talking about excision versus resection, where we say all of a body part versus some of a body part. That body part that we're talking about is body parts as defined by the distinct character values in PCS. So it may be slightly different than what you're used to in terms of your anatomy, because, for example, you might have separate body parts for your lobes of the lung, for example. So if it has its own body part value for one of the individual lobes, then you're going to take that body part value and apply the definition. Did they remove all of that particular body part? In which case it would be a resection. Or did they remove just a portion of that distinct body part? In which case it would be an excision. So this multiple procedure guideline is telling you that when those distinct body part values are there and you perform the same root operation on those different body parts, you will code them separately. So the example given is a diagnostic excision of the liver and the pancreas would be coded separately, because the liver is going to have its own body part value and the pancreas is going to have its own. So even though we're using the same root operation, the code will be different because they are distinct body parts. Another example is excision of a lesion in the ascending colon and excision of a lesion in the transverse colon. Those would be coded separately because, again, the ascending colon will have its own body part value, and the transverse colon will have its own body part value. So you're going to end up with codes that are just different by that one character, meaning the body part value, right? That's the only character in the code that's going to be different, but it does create a distinctly different code. So you do have two codes, same root operation performed on two distinct body parts. You end up with two separate codes. Next, we have B. The same root operation is repeated in multiple body parts, and those body parts are separate and distinct body parts classified to a single ICD-10-PCS body part value. So the example here is excision of the sartorius muscle and excision of the gracilis muscle are both included in the upper leg muscle body part value, but you do code that as multiple procedures because they are being performed on separate and distinct body parts, even though PCS classifies it as a single body part value. So that one is not quite as clear as the other one, where we know we have two distinct body part values. In this case, the value is the same, but these are two different muscles. So even though both of those muscles end up being coded to the same body part value, because they truly are two different muscles, you're going to code them separately. And they give another example, extraction of multiple toenails are coded separately. Next, we have C. So when multiple root operations with distinct objectives are performed on the same body part. So in this case, your body part value is the same, but it's the root operation that is different. So here they have as the example, destruction of a sigmoid lesion. So that's one root operation all by itself. And then they do a bypass of the sigmoid colon. Well, that's going to be a completely separate root operation. So you're going to code those separately, even though it's the same body part, two distinct root operations with distinct objectives, you're going to code them separately. And then finally, we have, you are going to code multiple procedures when the intended root operation is attempted using one approach, but then it's converted to a different approach. And the best example here is when you have any type of procedure that is started out as a laparoscopic procedure. So they think they're going to be able to achieve it laparoscopically, which is less invasive than open. But for whatever reason, they have to go ahead and convert it to an open procedure. So they gave the example, laparoscopic cholecystectomy converted to an open cholecystectomy is coded as a percutaneous endoscopic inspection. That covers that laparoscopic cholecystectomy part. It's because they don't get to the cholecystectomy piece yet. For the laparoscopic side, you end up coding it just to an inspection because they inserted the scope and reached the site, but for whatever reason can't do the actual ectomy piece, which is your resection, right? So you end up with just the inspection for the first code to capture their resources and their time and effort where they did try to do it as a laparoscopic procedure. And then you have the open portion because they converted it. So now you have to code the open cholecystectomy. So you have just a laparoscopy and then you have an open cholecystectomy. Those become your two distinct root operations, your two distinct codes, because it was a laparoscopic procedure converted to an open procedure. So you end up coding both of those. All right, so now we're going to get into a little bit of practice. And what I'm going to do is just kind of walk you through like some terminology. And when you're faced with the terminology in the health record, how do you actually translate that terminology into root operations? So that's really what this presentation is all about. How do I know what I'm reading? How do I take what I'm reading and translate that into PCS terminology? And this is going to rely heavily on your knowledge of medical terminology. So it will help to have a medical dictionary handy if you're rusty on your medical terminology. And not only just like a paper hard copy of a medical dictionary, if you don't happen to have one of those, there are online versions that you can access. You can just use your internet search engine for a medical dictionary, and you'll probably get a variety of them that come up. So you can use online versions as well. But while you're learning, it is very important for you to take the time to look these things up and to do that extra research as part of your learning process. Because if you're just guessing rather than really understanding what you're reading, then you're not going to learn that way. So you really need to take that extra time. If you don't understand how a particular procedure is performed, look that procedure up and learn about that procedure, because that's going to help you figure out what body parts we're dealing with, what kind of operative approaches we're dealing with. It'll help you determine, okay, what root operation should I be using? So always take the time to stop and do the research if there is something that you do not understand. So have your code book handy, and you're going to be using mostly Appendix B for this, because that's where you're going to find your root operation definitions. And then, like I said, if you have a medical dictionary handy, use that as well. Feel free to pause and try to look these things up on your own and figure out what the appropriate root operation will end up being. And then press play, resume again, and then we'll discuss what the answers are. So what I'm going to do here is kind of present a procedural statement for you. Now, obviously, in the real world, you would have the actual procedure note. So you would have some of the details that are probably missing from a few of these scenarios. But this is just an exercise in looking at the terminology and trying to break that down into, well, what do these terms even mean? What is the objective of the procedure? And therefore, what is the root operation? Because remember, the objective of the procedure is what determines the root operation. That's what the root operation is. What is the intent of the procedure? What's the objective? What are they trying to accomplish? So always think of it like that, so that you can kind of frame your mind, not necessarily how did they perform it, but what is it they're trying to achieve? That's what you need to figure out. So with a lysis of adhesions, what are they trying to accomplish? What is lysis? What are adhesions? What is it that they're trying to accomplish? So pause the recording while you try and figure it out on your own, and then resume, and we're going to go ahead and discuss it a little bit further. So I have a little bit of a picture here that will help by way of explanation. Lysis of adhesions is essentially a surgery that is, the intent is to cut the bands of tissues, which are called adhesions, that form between organs. So in the image here, you can see how they're kind of tied together. All these little folds are tied together by these bands of adhesions. So the lysis of adhesions, they're often there as a result of scar tissue that forms after some type of a procedure. So this is the scar tissue that performs, and sometimes it attaches organs to like the abdominal wall or to each other or something like that. So lysis is simply destruction or detachment. So we know they're trying to destroy or detach, and it's the adhesions that they're trying to eliminate, right? To free up the organ. So the objective is to free the body part by removing the adhesions. So that objective is our key. We have to look at our root operation definitions and go down the list there and say, okay, which of the root operations fit that objective to free the body part by removing the adhesions? And you should have landed on release. The definition of release is freeing a body part from an abnormal physical constraint by cutting or by use of force. So that's where the lysis comes in. That's the detachment, right? So the objective is to free the body part from the abnormal physical constraint by cutting or by use of force. So lysis of adhesions ends up being a root operation of release. So that was the first example, and that's how we're going to walk through these cases. I just have a few scenarios for you just to kind of give you a feel for how to approach these when you're reading them in the health record. Up next, we have a tonsillectomy. So use your medical terminology to break down that term, tonsillectomy. What does it mean? What is it that they're trying to achieve, or what's the objective? And therefore, what is the root operation? Again, pause and try and figure this out on your own, and then resume, and we'll come back and discuss it. So here's our explanation for this one. Tonsillectomy is simply the surgical removal of the tonsils. Tonsil is our body part. Ectomy is the suffix ectomy, which simply means the surgical removal. You have to be careful though when you see procedures that are called ectomy, because that tells us that it is a surgical removal, but what it does not tell us is whether or not they removed all or some of a body part. So those details are going to be in your procedure note. And for the sake of this scenario, we're calling this a total tonsillectomy. So they're completely removing the tonsils. So the objective is to remove the tonsils, and then your root operation is going to be resection. Now, if they did a partial tonsillectomy, it would be an excision. So I want to clarify both of those because it's going to depend on what is documented in the health record. So resection, cutting out or off without replacement, all of a body part. And the excision would be, so if they did a partial tonsillectomy, the excision would be cutting out or off without replacement some of a body part. So just that one word difference between those two root operations. And that's where the devil is in the details. It comes down to, you know, what is in the description of the procedure note. So you can figure out, did they take them all out or did they only take a portion of it out? And so that's going to help you determine. And tonsillectomy, this is just a side note, but this is one of the procedures where you actually end up with an external approach. An external approach we don't use too often as a surgical approach, but this one, they can actually reach it from the outside with their own eyes. They don't have to puncture or anything like that to reach the operative site. So the operative site is exposed right here in your throat, right? They're right there out in the open. So this is one of those ones where you're going to have an external approach. So that's just a little tidbit for you. Up next, we have a fracture, and the procedure is going to be an open reduction with internal fixation, or what we call ORIF, O-R-I-F. Whenever you see that documented in the record, O-R-I-F, that's an open reduction, internal fixation. So what exactly does that mean? What is the objective? And therefore, what is the root operation? So the open reduction with internal fixation is AKA ORIF, as I mentioned, and that is simply a surgery to fix the fracture. A few things that we get to know from that is that it is an open, so open reduction, right? So we know that it's an open procedure. And what they do is they use hardware to hold the bone together. So they have a fracture and they need to be able to realign those bones and hold them in place while they heal. So the objective is really to realign the bones. That's what the purpose of the open reduction is, to realign them, hold them in place so that they can heal. So our root operation becomes reposition. And the definition of that is moving to its normal location or other suitable location, all or a portion of a body part. So that's what they're doing here. They're realigning those bones. So the root operation is reposition. Up next, we have a percutaneous transluminal coronary angioplasty, or PTCA. So what does that mean? What is the objective and what is the root operation? And this is a case where, you know, in addition to your medical terminology, it might help for you to do a little bit of internet research, you know, use your search engine to figure out what exactly is a PTCA, because you kind of need to figure that out. What are they doing when they perform a PTCA? Because that's going to help you figure out what is the objective of the procedure. Because we do have a few things there in the name of the procedure. You know, percutaneous is listed, so that kind of is going to help us with the operative approach. Transluminal, that's basically across the lumen. And coronary angioplasty tells us that they're dealing with the coronary arteries and they're doing some kind of a repair. So that's kind of how we break down the terminology, because plasty simply means repair. But you can't just say that because plasty means repair, that repair is our root operation, because you have to understand the procedure. What are they trying to accomplish? What is the objective? So always go back to that. What is the objective of the procedure? And this is another one where having that image is really going to help you understand what they are doing. So with a percutaneous transluminal coronary angioplasty, or PTCA, a balloon-tipped catheter is advanced to the heart and into whichever narrowed artery is affected. Inside of the artery, the balloon is inflated and deflated over and over. They inflate it, they deflate it. Essentially, they're compressing the plaque. That's what's the blockage, right? So when you have a blocked artery, there's plaque that is creating a blockage. So by inflating and deflating the balloon, what they're doing is compressing the plaque against the coronary wall in order to widen the artery, to widen that opening, because the plaque has caused it to narrow, which cuts off blood flow or decreases blood flow. So the objective is to widen the artery so that the blood flow improves. So the objective, again, is to widen the artery, and that's key to our root operation. So dilation is what we end up with, because what they're doing, what the objective of the procedure is to expand an orifice or the lumen of a tubular body part. And that's exactly what they're doing with a PTCA. They're opening up that artery. They're dilating the opening so that it increases blood flow. So that's how we end up with dilation as our root operation. Okay, so up next, we have placement of a Foley catheter. So first of all, you have to know what a Foley catheter is, where it's inserted, and all of that good stuff. So this is another one where stop and do a little bit of internet research if you need to figure out how this procedure is performed and what it's all about. Because again, what is the objective? A lot of times students read that placement of a Foley catheter. Oh, it must be insertion, because all they're doing is placing a catheter. So it must be insertion, right? But what's the purpose? What's the objective? Why are they putting in a Foley catheter? And that's what you need to look at. What is the objective of the procedure? And I'm going to keep saying that over and over and over again, because Understanding how to figure out your root operations is absolutely critical when it comes to ICD-10-PCS coding. That is generally going to be your starting place in your alphabetic index. And so it drives whether or not you arrive at the right table to be building your PCS code. So that root operation is key. So I keep saying, think about it like, what are they trying to accomplish? What is the objective of the procedure? So pause, do the research if you need to, and then come back and we'll talk about this one. So here we just have a picture of what a Foley catheter looks like. The objective of a Foley catheter is to drain urine from the bladder. So it's a urinary catheter and it's put in place in order to drain urine from the bladder. So our root operation becomes drainage. Drainage, the definition of that is taking or letting out fluids and or gases from a body part. So they are letting out urine from the bladder. That makes our root operation drainage. So completely different from insertion, if that's what you were initially thinking by the word placement. So you always have to go back to the objective, and the purpose of placing the Foley catheter is to drain the bladder, to allow the urine to flow out. So drainage, that is our objective. Up next, we have a septoplasty. So what does that mean? What is the objective? And therefore, what is our root operation? And you're going to break down the terminology. Septoplasty. And if you remember, septo, so septo is going to, the sept part is going to refer to the septum, and plasty always just means surgical repair, essentially. So rhinoplasty, septoplasty, whenever you see plasty, it's some kind of a repair. So you have to, again, look it up and figure out what exactly are they repairing, what are they doing, how are they doing it, so that we can figure out this one. So a septoplasty is a repair of the septum, and the objective is simply to repair the nasal septum. And a case would be like if they have a deviated septum. That's the most common type of septoplasty, really. So the root operation repair applies in this case. So plasty is surgical repair, and that's exactly what the objective is in this case. Repair, restoring to the extent possible a body part to its normal anatomic structure and function. So you can see in the pictures shown here on the slide, with the normal septum, it's essentially a straight line. And when it's deviated, you see now you have that crooked line. And so they have to straighten that out. They have to repair it. And so that's what they're doing with a septoplasty, root operation repair, restoring to the extent possible a body part to its normal anatomic structure and function. All right, so I have just a couple more for you. Let's turn to the next scenario. We have nephrolithotomy. What does it mean? What is the objective? What is the root operation? Pause, work on it on your own. Okay, so when you see the word nephro, you should know that they're dealing with the kidneys, and otomy simply means to cut into. So we really have to figure out what it is that they're doing when they perform a nephrolithotomy. A nephrolithotomy really is to, they go in there and the objective is to remove kidney stones. So the definition of nephrolithotomy is actually surgical removal of stones from the kidney. So in this case, our root operation is extirpation, which is taking or cutting out solid matter from a body part. So that's where the otomy comes into. So they're opening up and then they're surgically removing the kidney stones. Extirpation, taking or cutting out solid matter. So the solid matter is the stone from a body part, and the body part is the kidneys. Next, we have a lithotripsy. So take the time to look this one up. What does it mean? What is the objective? And therefore, what is the root operation? So a lithotripsy is essentially a procedure that breaks up stones so that they can pass naturally. So they often use the ultrasound shock waves to, the shock waves cause the stones to break up into smaller pieces. And the point of having them break up is so that they can pass naturally. The larger stone there on the left side of the image is too big to pass into the ureter. So they break them up into small pieces so that they can naturally pass on their own through the ureter. So they're not actually opening the patient up in this case. They're not actually physically removing the stones. They're leaving them in place so that they can pass naturally. And that's important to figuring out your root operation, because we just had a removal of kidney stones, which was completely different. That was extirpation. In this case, the root operation is fragmentation, because the objective is just to break them up. So breaking solid matter in a body part into pieces is the definition of fragmentation. And that's what applies in this case. They break them up and then they just leave them there, and they will pass naturally. So that's what we have for our lithotripsy. And that was the last scenario that I want to walk through, because I'm trying to keep this a little bit short, but I want to set you off on the right path so that you can do this on your own with any type of scenario. Break it down into the terminology, figure out what it means, figure out what the objective is, and therefore what is your root operation. And just some tips for you. Utilize your medical terminology. But remember, this is not set in stone. And by that, I mean, just because they use that word does not mean that is your root operation. Because like plasty was a good example. Plasty simply means repair. And your ORIFs are repairs as well. Sometimes you have to figure out how they performed the repair to make sure that that is indeed your root operation. So how did they accomplish the procedure? But a lot of times when you see centesis, you're going to be looking for a drainage type procedure. ORIF is a repair. Lysis is going to be a release. Desis is a fusion. Ectomy, remember I mentioned that one earlier, that could be either a resection or excision. So you need to pay attention to all versus some of a body part. Tripsy is usually a fragmentation. Plasty, we talked about, a repair. All of your ostomies is usually going to be a bypass, because what they're doing is creating a new opening. They're bypassing something and creating an artificial opening. So it might be a colostomy, it might be a tracheostomy. So whenever you have your ostomies, that's going to be a bypass. Oscopy. So think of laparoscopy, cholecystoscopy, anything that's oscopy. Oscopy simply means inspection. But again, that does not mean your root operation is inspection. You have to figure out the definitive procedure. What was the objective? Sure, they used a scope to accomplish it, but what was the intent of the procedure? So if you have a colonoscopy, this is a good example. A lot of times you have a screening colonoscopy. Once you reach a certain age, everybody gets a screening colonoscopy, and they go in, visualize and inspect your colon, right? If that's all they do, inspection is appropriate. They go in, they look, oh, everything looks fine, no problems, we're done. That's an inspection. But we always have to watch for a more definitive procedure. So say they're doing a colonoscopy, they get in there and they find some polyps and they have to remove the polyps. So they're doing a polypectomy while they're in there. Inspection is no longer your root operation. What happens is that oscopy part becomes a key in your operative approach, because you're going to be using one of the surgical approaches that are endoscopic. So it helps you in terms of your approach, but now we didn't just inspect, we did something while we were in there. So now you need the excision piece for the removal of the polyps. How did they remove them? What all did they take out? And then you figure out your root operation from there. So anytime you have an oscopy, be careful there, because if you use the index and just look up colonoscopy, for example, it's going to lead you to root operation inspection of the colon, because that's what it translates to. But as a coder, you have to look at the full details of the procedure note to see, did they do more? Remember, you're translating what is written into PCS terminology. So just because they said oscopy for inspection doesn't mean that's the end all be all. So that one's an important one. Stasis is usually going to be some kind of a control. So hemostasis, epistasis when they have the nosebleed and they have to control the bleeding there. So control, that's another one. Otomy is usually your division or drainage, because otomy simply means cut into. So you're either dividing it or you're cutting into it to let fluids out or something like that. Because just cutting into all by itself would simply be the operative approach, right? So we have to figure out what is the objective of the procedure. Did they just open them up to do something else, in which case that something else is going to be your root operation, or did they do it to drain or to divide, in which case one of those would be your root operation. So I hope you found that helpful. That concludes my presentation. I know that root operations can be tricky, so it is definitely worth taking some time to work through them and to break it down into those little small pieces like I mentioned. Always use your appendices in the back of your ICD-10-PCS code book. While you're learning root operations, there are a couple appendices that I want to mention. So the first one is going to be where all of the root operation definitions are simply listed. So Appendix B is your root operation definitions, and they will just go down in alphabetical order. So starting with the medical and surgical section, alphabetically, all 31 root operations for med-surg. And then the next section is obstetrics. So it will then go alphabetically, all of the root operations that go for the obstetrics section, and then the placement section. We advise you to make flashcards for these root operations, because having the term on one side and the definition on the other side is a good way to learn your root operations. But also pay attention to some of the examples that are given. So they might give you an example of that particular root operation. So transplantation as an example. Transplantation, it gives me the definition: putting in or on all or a portion of a living body part taken from another individual or animal to physically take the place and or function of all or a portion of a similar body part. So it gives you that full definition, but then below the definition, it gives you an explanation. And the explanation says the native body part may or may not be taken out, and the transplanted body part may take over all or a portion of its function. So that's just a little more description to go along with that definition. And then it gives you an example: kidney transplant, heart transplant. So the root operation definitions are helpful in that respect, because what you're going to see at the top of the tables is just the definition. It's not going to have that explanation or examples. So Appendix B is what you want to utilize for that. And then the other one is Appendix C. Since the medical and surgical section is the largest section that you're going to utilize, what they've done in Appendix C is they've broken all of those 31 root operations into comparable. So they put them into buckets of similar types of procedures. So if you study them kind of in those buckets, or if you know that, for example, the procedure you're performing does a certain thing, you can narrow it down to just those similar types of root operations. So for example, the first bucket in Appendix C is procedures that take out some or all of a body part. So it gives you all of the procedures in med-surg that take out some or all of a body part. So the objective is to remove some or all of a body part. So if you know the procedure you're looking at has the objective to take out some or all of a body part, that narrows it down for you to either destruction, detachment, excision, extraction, or resection. So this appendix tells you it's one of those 5 root operations that you're dealing with. So you can narrow it down by, well, did they do some or did they do all? Was it an extremity only? In which case your only choice is going to be detachment. So these are ways for you to kind of process of elimination, figure it out. So they have these buckets. The first one, procedures that take out all or some of a body part. The next one, procedures that put in or put back or move some or all of a body part. And in that bucket, we have reattachment, reposition, transfer, and transplantation. The next bucket is procedures that take out or eliminate solid matter, fluids, or gases from a body part. We have drainage, extirpation, and fragmentation. So only 3 choices for that bucket. Next, we have procedures that involve only examination of body parts and regions. That's going to be either inspection or map. And then we have procedures that alter the diameter or root of a tubular body part. You have either bypass, dilation, occlusion, or restriction. Next, we have procedures that always involve devices. So if you're using devices, and remember, devices are things that are left in place after the conclusion of the procedure. So we have change, insertion, removal, replacement, revision, and supplement. Procedures involving cutting or separation only, division, and release. Procedures that define other repairs. We have control and repair. And then finally, the last bucket is procedures that define other objectives. So we have alteration, creation, and fusion. So that's Appendix C, comparison of medical and surgical root operations. And just to plug in here that the appendices in ICD-10-PCS, they are helpful resources that are there for a reason. So become familiar with those appendices. They really are going to help you along the way in the coding process. There's all kinds of great information in those appendices. So take the time to review those so that you know at least what appendices are in your code book. So what's there and what they cover. That way, maybe you'll have that light bulb moment when you're working on a certain procedure. You'll be like, oh yeah, I think there was an appendix that was related to that. Let me go check. So by reviewing to see what's there, you'll at least know that they exist so that you can refer to them when it's appropriate. So I hope you found this presentation helpful. And if so, please click the like button and subscribe to my channel for more content on medical coding with Dr. Teal. Take care, and Dr. Teal out.